Hello, hello. Hi there, Lisa. How are you doing today? Great. What are you here for today? A sleep consultation? Yes, we can certainly help you with that. Let me go ahead and actually get you checked in real quick. We have been so busy today, and it doesn't look like you've been properly checked in, so let me get that going. While I am filling that out, can you go ahead and start filling out some forms for me? It's pretty generic stuff. It's just a quick questionnaire, and then we'll go over it together. Okay, here you go. Okay. Just pull up your file and get you all checked in. Can you go ahead and confirm your date of birth real quick? Perfect. And your last name was, yes, can you spell that for me? Okay. Great. The address that we have on file is on North Street. Is that still accurate? Great. And your phone number? Okay. Perfect. Do you have a preferred pharmacy? That's the one on Main Street. Perfect. Almost done here. And an emergency contact. Okay. And their phone number. Great. Now, if you can just hand me your insurance card, and I will go ahead and type in all that information while you finish up the form. Perfect. Thank you. That is the basic insurance. Okay. Looks like you are all checked in. All done with the questionnaire? Great. Reason for a visit, you said a sleep consultation. Specifically, you have some concerns regarding sleep apnea. When did you first start noticing symptoms? Okay. I see you listed one of the things here, that you do snore pretty heavily. When you snore at night, is it loud enough that you wake up others? Okay. What about yourself? Do you ever find that, you snore and you will startle yourself awake or wake up feeling like you're choking? Okay. And would you say that that happens in all sleep positions, or is it only when you're laying flat on your back? Okay. Okay. Do you know if you have ever stopped breathing while sleeping? Okay. I see you listed on here your height and weight. Okay, let me just put that into the computer. Medical history, really nothing of note there, but any family history with sleep problems. Okay. Who was that? Okay, they do as well. Okay. I see you listed here an average number of sleep per night. Okay. And your typical bedtime and wake up. Is that for the weekends as well, or only on weekdays? Okay. What about your work schedule? Is that pretty consistent, or are you on rotation sometimes at night? Okay. I see you did include a little bit of information on your sleep environment. You used blackout curtains, so that's awesome. Do you happen to know what temperature you keep your room at? Do you wake up pretty often throughout the night? Okay. Do you wake up in general? Would you say that you wake up feeling well rested? Okay. Do you often take naps? Okay. I see you marked here that you've never had any issues, never fallen asleep at the wheel, don't get sleepy throughout the day. What about if you are, quietly reading a book or just sitting down quietly at your desk? Have you ever had any issues with feeling very sleepy? And no medications, is that correct? Okay. Perfect. So next we're going to do a very quick physical examination. I'm going to take a look at the back of your throat as well as your mouth and your nose just to see if there's anything that really stands out as potentially causing any sort of blockage of the airway. Okay, good. I will also take some quick measurements, specifically the circumference of your neck and your waist. Okay, good. Let me get some gloves real quick. It's still kind of cloudy outside, or did it clear up a bit? Perfect. Now I'm sure by the time I get out, it'll get dark again. Let's enjoy that sunlight, but hopefully it stays for the weekend. Okay, so let me go ahead and take a look at your throat bit. And let me just feel real quick right there. Now, if you can go ahead and open your mouth and say, ah. Okay. Very good. Great. Okay. And now, if you will tilt your head up, I'm just going to take a quick peek at your nose. Okay. Let me just jot down a couple notes here. Next, I'm going to just take some measurements around your neck and your waist. That's okay with you? Okay. Just sit down real quick. Perfect. let me go ahead actually and get your blood pressure as well. So if you could please stick out your arm. Just wrap this around. And release the air. Good. Okay. You're all set with that. Now, let me explain the testing process a little bit. You will be completing a nocturnal polysomnography. Basically, it's just to detect your breathing patterns. We're going to see if there are any moments throughout sleep where you stop breathing. So perhaps an event like apnea, where air is not reaching the lungs for 10 seconds or more, or even a hypopnea, where there is a partial blockage of the airway for 10 seconds or more. Now, there are a couple options to complete the test. You can check into the sleep clinic here and stay overnight. If that's the case, we'll hook you up to a bunch of monitors. We'll look at your heart rate, any lung activity, obviously your oxygen levels, any breathing patterns, any arm or leg movement, things like that. Yep, so you would just stay hooked up to the device throughout the night. And if it's something very severe, our nurses could come in and for the second half actually give you a sort of machine to help you breathe throughout the night. Or if things are looking, not too severe, we'll just continue monitoring. So that would be one option. I will say, however, it can be a little bit difficult to complete that test just because you are outside of your typical environment. And that could affect how your body reacts. I know I personally have a very hard time sleeping anywhere. It's not my bed or my own pillow, so that can skew the results a little bit. The other option would be to complete it at home. So when you complete it at home, it isn't as extensive. We don't get all the same data as you would complete in a lab, but again, you're doing this in the comfort of your own home. And so with that, we would send you home with a little kit. There it has a device, and we would give you instructions on really how to set it up, as well as some paperwork. But you essentially just connect it to put a little clip over your finger, and then it'll have a mask that can go over your nose. And you would go to sleep as usual, keep it on throughout the night. Then you would turn the test kit back into our office, and I'll say within a week, you'll get a call back to schedule a follow-up appointment. We'll go over the results of the test. Do you have a preference if you check into the clinic, or would you like to do it at home? Perfect. I will let our nurses know that you would like to complete at home. So when you check out today, out at the front, they will have a kit ready for you. We just ask that you complete the testing within a week or so, and then turn it back in. You can stop by any day to just drop it off, and then we'll give you a call when the doctor has had a chance to review the results and would like to go over those with you. Very straightforward. There'll be some paperwork with the test kit as well, just going over some of the details, but high level is basically what I told you, as well as making sure that you do not have any coffee in the afternoon that day, and no naps either. That can affect the results of the test as well. Okay, good. So I think that we are all set for today. I've already pinged our nurse. They have been getting a test kit set up for you. So whenever you are ready, just step on out to check out. They'll get you all checked out and hand you the test kit. And then I should see you back hopefully in a couple weeks. Alrighty, I'll see you again soon. Bye now. Hi, so good to see you again. Please take a seat, get comfy. Yes, no, I'm glad that it was so easy to take the test at home. Yeah, good. We do have the results of your test. Polysomnogram did show some interesting results. I'm very glad that you decided to complete the test and come in for a consultation. So just to give you a little bit of a breakdown of the results, what we're really looking at here. Here is a copy of your results. just to give you a little bit of a breakdown, what you're looking at here is the polysomnogram. Just looking at how your breathing was throughout the night with the study. That number right here is the apnea hypopnea index, or AHI. Basically, that number is the average number of times that you had a sort of sleep event, so apnea or hypopnea, and that's the average number of events per hour. Now, if you look at that breakdown here on this chart, a mild case would be 5 to 15 events per hour. Moderate is 15 to 30, and then a severe case is 30 and up. You had 20 events, so 20 times that you weren't breathing on average per hour. Yes, I know. It can feel a little intense when you look at it that way. But yep, you for sure qualify to move forward with some treatment. Now, there are a couple different treatment options. I will explain them all for you, but your case, with it being moderate, we do have some flexibility on how to proceed forward. So the treatment that we really highly recommend would be a continuous positive airway pressure. Basically, you would be wearing a mask throughout the night. The mask can go over just your nose or your nose and mouth, depending on what type you get. If you decide to move forward with this option, we would have you come in on another day. It would be about an hour-long appointment where we show you the different masks option, let you try on a couple of the different styles so you can pick which one you think is most comfortable. And we would also make sure that it has the best seal. And we would go over how to clean the device, how to set it up every night, but it is very straightforward. This would help reduce the number of events that you have per hour. It's actually really interesting. You can download an app as well, so you can track how you slept that night. It'll tell you that AHI number as well. Yep. So you can see for yourself how many events you had per hour the night before. We encourage you to use it for at least 7 hours each night. And the app will tell you too if there were any seal issues, or if you had to, if you had to wake up for whatever reason and take off the mask throughout the night, it tracks that all as well. The really cool thing there is that you're really able to track the data, so you can see, at the start you had, 20 events per hour. After 2 weeks, you just had 10 events per hour, whatever it may be. So ideally, you should be feeling well rested, wake up energized for the day because you're breathing better throughout the night. Another common treatment would be the use of a mouthpiece. That just really helps to make sure that your throat stays open throughout the night. You don't have any blockage of the airway. For that, you would need to work with a dentist to get fitted. But same benefits. You would have less events per night, wake up feeling refreshed and not as tired throughout the day. Now, our very, very last resort, and this is really only in severe cases, or if the other two treatment options don't work, would be surgery. I would not recommend that for you at this point in time, but basically the surgery options would be like a nasal surgery or a jaw surgery to essentially move your jaw forward and really enlarge that space between the tongue and the soft palate. There are also surgeries to remove tissue from the back of the mouth and the top of the throat, or even a surgery to install a device under the skin at the top of your chest. This would be an airway stimulation system to essentially stimulate those nerves that control the tongue's movement. Basically, the goal of any of the surgery options is really to enlarge that air passage. But again, this is really only for severe cases and if the other treatment options don't work. So I would not recommend that for you at this moment. But between the mouthpiece and the mask for that positive airway pressure, do you have a preference? The mask. Okay. Yeah, that's really what we encourage our patients to start with and to see how it goes. A lot of people have had great results with that, so I am very hopeful that you will have some great results as well. Okay, other than that, there are a couple things that you can do to help improve your sleep quality as well. I have a pamphlet around here somewhere. Right here. There you go. Basically, just making sure that you're eating right, getting in some exercise, not too close to bedtime though, because that can negatively affect your sleep. Make sure you're staying hydrated, drinking lots of water, really limit your intake of alcohol. That can affect it as well. Keep using the blackout curtains, just creating that very calming environment. Make sure you're not using your phone too close to bedtime. Little things like that, but those small details make such a big difference. The position that you sleep in as well, since that affects how your tongue lays as well. If you're sleeping on your back, it might be causing some of that blockage. So try sleeping on your side or your stomach. That can also improve your situation. And if you're congested whenever you get sick, try to use the saline spray to really keep those passages cleared. So that goes over all of the results of your test. Do you have any questions or concerns? Okay, great. So you can go ahead and start heading up front to get checked out. They'll work with you to set up an appointment to come in and get fitted for the mask. Alrighty, good to see you. Have a good one.